Well, good morning, good afternoon, good evening, whichever part of the world you're on. My name is Yanick Hicks, and I am truly excited to have our guest on this podcast today. You're in for an amazing treat, and we have Dr. Kathryn K. Welcome, Dr. Chick. Thank you for doing this podcast with us.
Oh, I'm so glad to be here and glad to help out.
Absolutely. So even before I had this having this session with Dr. Cheek, we spent some time last week and got to learn a little bit more about her background. It's just an incredible career that she has. And Dr. Cheek, if you don't mind, just share a little bit about your background and how did you even get started in doing what it is that you're doing currently?
Um, well, I am Dr. Kathryn K, as you said. I'm a pediatrician for just over 40 years. I did general pediatrics in Columbus, Georgia for 37 years with one practice and enjoyed every minute of it. It was quite a privilege. I had to retire just because my hearing is not as good as it used to be. I wear hearing aids. And I near the end sort of felt like when my little children were talking to me, I couldn't hear them. And I felt like I got in their space a little bit more than I felt comfortable with it because I would be going, "Hey, darling, what'd you say?" And, that was sort of the, I guess, indicator to myself that maybe the good Lord was saying it's time for you to use your talents and expertise in a different way. And I felt like it was time. So I love my private practice. I had wonderful families and patients that I worked with. And now I'm in theory retired. However, I have a lot of different jobs. The one job that you got to know me from is the fact that I'm chair of the Composite State Medical Board for the physicians of Georgia. I've been on the board for about 4 years, enjoy that work as well, but it does give me a different perspective of medicine. It has encouraged me to be a teacher. I actually give lots of talks to residents, house staff, interns, people in residency about the Georgia Composite Medical Board and professionalism and how important it is to be a doctor and to provide good and safe medical care for all the constituents of Georgia. I've learned a lot being on the medical board, and I've learned some of the things that can get physicians in trouble. And so I want to educate the new leaders that will be coming forward to make sure that they understand all about the importance of professionalism, the importance about taking good care of themselves, which brings me to my next point in Columbus. Most recently, I've been involved in the development of what's called WELL, W-E-L-L, for PEDS, and we're specifically targeting pediatricians in our community. Before COVID, we used to get together as a group. We had our grand rounds where we met in person, that was at least once a month. Quite frequently, we had events in our own homes where we would do look at reports or just talk about the state of medicine or perhaps talk about something interesting that was in medical magazines. Now people don't read magazines anymore. We can learn about it all online, but just talk about updates for the field. And then after COVID, we all got in the habit of not being together. And I think those of us that had experienced some of that togetherness, even though that we were not partners in our day-to-day life, we were professionals in the same practice. And we felt like some of our community went away. And as I talk about wellness, but it's really as I talk about the profession of medicine, I think it's so important for relationships with our patients and families, but relationships with our peers. That helps make us better physicians. So with this Well for Peds, we've sort of instituted a new way of getting together and providing some, not just R&R time, but just a reflective time to make sure that we're spending enough moments getting some health care for ourselves. And I think so far, I think it's been worthwhile. We just started in Columbus about of October of last year, so it's not been going that long, but have received a lot of positive reinforcement about what we're doing.
Wow, that is amazing. That's a whole lot that you can even do. 37 years. I'm just thinking about 30. I graduated from pharmacy school over 8 years ago, and I still got 30, 30 more years to go. So I can be able to, but that's incredible. Dr. Chick. So what inspired you to shift your focus from, clinical practice to the wellness and the initiative for pediatricians? What even inspired you to wanting to do that in the first place?
Um, I do think what inspired me was being on the medical board and seeing
Mhm.
physicians that are sometimes having struggles and making some of the bad choices. We need to look in all directions that we can to make sure that physicians have an opportunity to be well-rounded, to be well-centered, to make the right decisions for themselves as well as their patients. And physicians are very resistant, myself included, to sometimes taking the help that we need. And this way is a preventative. It's not punitive. It's a way to make sure that as a community we can help each other.
I love that because, you know, physicians play a critical role in healthcare, and one of the challenges in healthcare is burnout. You're burned out, there's understaffed workforce shortages, and the turnover it's high, so retention is really big. And so with physicians being those leaders in healthcare, if they take care of their health and their wellness, they're able to take care of the patient because the overall goal is to improve patient outcomes and patient experience, and just kind of getting into the wellness and holistic approach to healthcare. That is really amazing. Can you share like a key lesson, experience from your 40 years in pediatric care that informs how you approach burnout and wellness today? Mm.
Um, I don't know if I have a key incident. I have lots of key, lots of things, because what I learned as a physician, especially as I've over these last 40 years, medicine has changed. Um, it is very different in the realm of when I started out. Female physicians were the minority. Now they're certainly equal or sometimes the majority in different professions. So that has changed. And I guess I have 3 children. So
Mhm.
I'd have to say the inspiration that set me on to wellness was those 3 children. And my learning to practice the profession every day and still be a mother and a wife in between, and not to
Wow.
make it seem like that they are in between, that they are really my top priority, both my husband and my children. And you have to figure out amongst in your own self,
Mhm.
how you make that work. And I think for everybody, it's a little different. And about the time you figure out, okay, I've got this, life changes. Your kids get a little older. Now they're doing soccer and basketball and baseball, you know. So I think it is an ongoing process. That's why it's so important to have people around you that could support you. I would say my friends that
Okay.
didn't work, that weren't professionals, were just as important to me, especially in being able to make my life work as my professional friends. And that's what I think as a physician, you've got to learn to be well-rounded in your community.
Wow, that is, juggling a great deal, being a parent, being a physician, being a mother, and then you have this wellness program. Uh, balance is one of balance is big, whether it's healthcare, resilience, people, like you said, people are in a different place. How did you work towards creating balance? Having all those, being a physician, sometimes you have a lot of hours at work, sometimes probably stressful, sometimes great, and then having kids and all the, and I see you're a person of faith. How did you, what was your secret? I don't know, secret sauce or what was your, how did you create balance? Uh, you
You
know,
know, it, there's no secret. It's your personality, and you have to remember that really at any moment, the person that matters the most is the person that is right in front of you, and then the person that is inside of you, and your beliefs in God. So I tried to focus my time on whoever was right in front of me to give them what they needed.
Mhm.
And, if it was my child or if it was a patient, again, in my mind, what's inside of you, which is hopefully led by your creator or whatever religious belief you believe, I want myself to come across as how I hopefully believe myself and how God would want me to act to someone. And then the next most important person is the person right in front of me. So I want to listen and make sure that I'm answering their questions and providing what they need. And I think if I'd have to say anything, that would be the thing that I would like to think that I focused on. I'm certain that I did not do it right every day, all day long, all those 40 years. But as you've aged, you realize, at least I've realized, that that's what matters most. Feeling like that you're giving the attention whoever's right there that needs that attention that moment.
Wow, that is incredible. Ladies and gentlemen, she's saying that I'm the most important person right now, right in front of me.
That's it.
She's
I'm
listening.
trying to make sure that I'm doing whatever you need for today.
Isn't that incredible? You just have to be present, right? She pays attention and listens to the person. And as we're making it up, well, how do the events like the Wow Wednesdays and your annual pediatrician family events strengthen connections and support among healthcare professionals?
We all get 1,000 emails. I'm sure you do, right?
How do we check?
A lot of them I don't want to read. Okay. And so we decided, because we kind of went back to what we did. Okay, we had pre-COVID. That was a whole nother land. Then we had COVID. And in COVID, my little pediatric group developed on a WhatsApp a way to talk to each other, because we had to change and pivot every day in COVID. We didn't know what was coming down, but we all had to make decisions about our practices and what to do for our patients. So through that just chat on the WhatsApp app, we all gave each other tips and hints and how we were doing it, because we couldn't meet. We couldn't get together. Remember, we weren't supposed to be. We were supposed
Yep, you had
to
to put
nobody, and we didn't. We couldn't go to the hospital and all that stuff. So, I think once again, COVID went away, thankfully, and we lost all that. But we sort of just went to a phase of not communicating, just everybody kind of carrying on their own separate lives. So we decided as a group to get together and just have a discussion back in October about how we could have a conversation that wasn't intrusive, that was something that we would look forward to, but that it wasn't impossible to make happen. So literally, basically, it's a listserv that we started that shows up every Wednesday in the inbox. You can choose to read it or not. We try to put something about the community that's happening. We can read all kinds of medical books about how to treat pneumonia or how to treat asthma. We get all that information. But a lot of times we don't get the information of Dr. Cheek is supporting this foundation or this fundraising event, or this is going on in Columbus, and it might be for kids, but it's not really medicine. It's just something that could be special for the children in your practice. Maybe somebody's giving out books somewhere on a corner, that kind of stuff. And so we tried to put an event. We try to put an event in there every week that's sort of different. It's not just medicine related. We also try to put some just inspirational thoughts for the person to say thank you for working as hard as you work every week, and think about the difference you're making for your patients and your families. And then we give people a chance to respond. And so if those that are making the newsletter don't know about some event, you can pop up in there and say, oh, by the way, the food bank is giving lunches for children this week at school. Can you contribute something? So those kind of comments and things that come up that we wouldn't have had a way to exchange. Additionally, if someone unfortunately dies or has a serious illness or serious event in their life, we can notify each other very quickly. Say, Kathryn's sick. She's in the hospital. Y'all pray for her, or y'all send her a card. I think that is just a connection that we had lost. And this is an easy way to get that going forward.
Wow. I mean, my mentor, John Maxwell, says success is what happens to you, significance is what happens through you. Just going beyond not only what you do as a medical professional, as a doctor and pediatrician, but looking for other areas to serve your community and foundations and nonprofit and caring for people beyond just maybe medicine. That's just incredible things that you're all doing. Community is something that is really missing today. There's a lot of isolation, especially, COVID just kind of intensified it because we're now isolated. And so anything that would get that community, because, when you're a community, there's power. We grow in community, really grow in isolation. And I love that. So thank you for sharing that. So I'll just do kind of like a, quick light round, and then I'll have you share your final thoughts and we'll wrap it up, right? So just, some things to lighten up to really see. So coffee or tea?
Coffee or tea?
Yeah.
I like both.
Oh, you like both equally?
I have to have coffie in the morning. But
Okay.
I like tea in the afternoons and evenings. So I'd say I'm not a coffee or a tea person. I'm both.
I'm both.
But that's sort of my personality. I like to experience a lot of different things.
Oh, okay. Wow. We get the coffee in the morning and then we're lighting it up in the afternoon with some tea. Wow, that's good. I can drink coffee, but I'm more of a tea person because I grew up with tea and things like that. Are you a morning person or a night owl?
Morning.
A morning person, yeah, I'm a morning person as well. I can get. What's your favorite way to recharge after a long day?
Oh, I like to walk outside. I live on a farm and I grow vegetables, and I have a dog, and we go for a walk, and we have a little pond we can walk around. And anytime I can just get outside and go for a walk, that's the therapy. I can have some conversations in my head and be perfectly fine.
I didn't know that walking was a therapy, and I wouldn't say I cannot, but I don't remember last time I went a whole day without going for a walk. Like I have to go out for a walk. Like I said, that's my thinking time, and just process reflection. Sometimes I don't even have to think about anything, just getting out of the house. I think even during COVID, after a while, I went out most of the time, every so often, because just being indoor for a while, I can. Yeah. One word your patients will use to describe you in your practice.
One word. Oh gosh. Um, that's really hard. I don't know the one word they would use to describe me. Um, they just make me smile. One of the best things that they did, what we had in my practice, we had a chalkboard in every exam room. And so lots of times the kids would draw pictures while they were waiting on me. And I love to hear and see the pictures, what they depicted. what they were thinking about, whether sometimes they would draw themselves getting a shot or they would draw themselves with a frowny face. So I don't know what they would say about me, but I know what I would say about them. I loved every minute of it.
Wow. No, that's very important. What's your favorite vacation spot?
With my family, wherever. It doesn't matter.
Wow, that's incredible. And the final one, if you weren't a pediatrician, what would you be?
Ooh, now that's another thought.
Maybe a
mm,
farmer? You
no,
plant.
I like to be around people. I think maybe I've been a teacher. I
Oh,
enjoy
okay.
I enjoy that. Now, one of the things you did not ask me about was my character tour, and I wanted to make sure you asked me about that. I gave you my character tour. Do you have any idea of why I sent you that character tour?
No, no. Oh, no, no. What is your character for?
Well, yeah, I sent you. Did you see? You saw the picture of me,
Yeah. I saw
and then the little cartoon of me.
Yeah, I saw the little cartoon, and
Okay, well,
then
the cartoon of me is showing me when I was in COVID, in the COVID system, and I was getting my COVID shot. So it's a nurse giving me a shot. But I really wanted to comment on the fact that sometimes we as the doctor have to step back and be the patient. And that way, we have to take the shots. We have to take the shot of wellness. We have to take the shot of some of our own prescriptions so that we can be better and okay to provide treatment for others. So, I'd encourage all of us to go get your shot in terms of making sure whatever it is that helps you understand yourself, and also what helps you be a better person, and you, like you said about yourself, taking that moment to walk outside is what we all need to find, the help that helps us all become a better person. And you found it in your walking and your thinking, but all of us need to find that spot where we can take a deep breath and have a little reflection time, because I think reflection is very important for all of us.
Absolutely, I agree. I mean, reflection is part of my life. I don't remember a day go by without spending some time in reflection, reflecting on my day, reflecting on my life, what changes I need to make, what's working, what's not working. That's why I love going for those walks. I have to even do one later on in the evening. I do one almost twice a day, one in the morning or afternoon and in the evening. Um, so, Dr. Chick, final words. There are some maybe people that are aspiring physicians in this group. Maybe they're growing, or people that are just looking to move up the ladder in healthcare, or they're already healthcare executive. In your extensive amount of experience, almost 40 plus years, what is, if you had to give this healthcare leaders and executive some lessons, or maybe a lesson for them to carry on with, what would that be based on your?
Always be thankful for the privilege to serve our patients, and give back. We all learn on patients that are most of the time indigent patients, or patients that don't have the ability going forward. Like once we finally get our license, they may not be able to see us because maybe we don't take their insurance, but reality is that I think all of us need to understand that the people that taught us, our patients that were our initial treatment teachers, invested in our education. They gave their bodies, they gave their lives, they gave their stories. They made us who we are. So going forward, we need to look back and figure out going forward a way to pay it forward or to pay it backward. And I think that will make us a better leader if we do that.
Incredible. Thank you very much. Such a great perspective, lessons learned from wellness to Wow Wednesdays to your experience in healthcare. I just want to thank you, Dr. Chick, for sharing your experience and story with us, and how you continue to make an impact, not only in this time, but for the next generation. because a leader's lasting value is measured by succession, by what you put in people right after. So thank you very much. I appreciate your time.
Well, thank you so much, and thank you for the work that you're doing to help spread the word. And I'm working on leadership. It's very important to develop good leaders going forward. So thank you.
You're welcome.